In this video, we're going to take a look at the intracerebral stroke. So we've already talked about subarachnoid stroke, or the hemorrhage within the subarachnoid region of the brain. So again, that's going to be in that subarachnoid space, which is generally the middle layer of the meninges. So in our subarachnoid space, we have usually rupture of an aneurysm from our circle willis that's going to cause blood accumulation between that dura and pia space. So basically in that subarachnoid space, or the arachnoid space. As a result, blood builds up and starts to put pressure on the brain. Now, when we're looking at the intercerebral stroke, or the intracerebral stroke, this is a stroke where we're looking at defined areas of blood flow that's going to result in hemorrhage within very specific regions of the brain. So usually that's going to occur further in and deeper within the brain, and usually presents with more specific symptoms, and is generally fairly severe, rapidly progressing in nature. So there's a number of different areas that we can talk about in terms of intracerebral stroke, or the areas that are most likely affected by intracerebral stroke. So we may see stroke occurring in the cerebral lobes. So if we're looking at our cerebral lobes, again, we're looking at those areas like our motor cortex or our auditory cortex. So the areas of basically are the defined lobular areas of our brain. So we can have, say, this is our middle meningeal artery coming off, and it supplies the right side of our brain. If we have hemorrhage within this area, or we have basically a rupture or bleeding from this area, we start to see ischemia in that area of the brain. So again, what's happening is we have some sort of microhemorrhage or some sort of issue that's occurring that's causing bleeding within this very specific region of the brain. So if we think about where we're looking at in terms of the cerebral lobes, it's going to cause very similar signs and symptoms to a typical stroke. So if this is our cerebral lobes, depending on the area of hemorrhage, the signs and symptoms are going to be specific to that area. So just like a stroke, these patients should show things like facial drooping, hemiparesis, hemiplegia, impaired gait, slurred speech, inability to move the tongue correctly. All of those types of things that are normally correspond with an ischemic stroke. So if it's simply our cerebral lobes that are affected, or an area of our cerebral lobe, these patients are generally going to present with very typical stroke-like symptoms. If we look at our other areas that can be affected, the basal ganglia is often very commonly affected in our intracerebral bleed. So basal ganglia is an internal portion of brain structure. So if I have hemorrhage from one of the arteries that is supplying the basal ganglia, and I start to have ischemia and decreased perfusion to my basal ganglia, I'm going to start to have very specific symptoms related to that. So these patients will usually initially present with things like movement disorders, because our basal ganglia is primarily responsible for generating movement and coordinating movement. So these patients will have symptoms related to movement, so movement impairment. Another area of the brain that is commonly affected by a intracerebral stroke, or bleed within the internal workings of the brain, is the thalamus. So thalamus is basically the internal relay center of the brain, and is responsible for a lot of our special senses, or a lot of relay of our special senses, and as well as our just typical sensory information. So if I have same thing, some sort of intracerebral hemorrhage within the thalamus of my brain, generally you're going to lose a lot of lose a lot of the special senses, or basic sensory function. So if we have, our thalamus is also commonly affected, and we often see things like a decrease in our special senses, and a general impairment in sensation. Another area of the brain that's commonly affected with an intracerebral bleed is the pons. So we have little, basically pontine arteries that come off of our circulation for the brain. And if we have ischemia in these areas and the pons is affected, again, we start to see symptoms related to things like pupillary response, to respiration, and to consciousness. So we have our pons here as well. So things like pupil changes are very common because of where the cranial nerve nucleus lies. Pupil response. So these patients may have pinpoint or dilated pupils. We may see ptosis or drooping of the eyelid, vision disturbances, and respiratory problems. And finally, the other most common area affected by someone who has a intracerebral bleed is the cerebellum. So we may see ischemia or hemorrhage in the area of the cerebellum, which is generally involved in coordination of movement and eye movement. So again, these people are going to have usually disturbances in terms of movement and eye movement. This is our cerebellum. And again, symptoms usually revolve around coordination of movement and eye movement. Now, it's important to remember what's happening in this case. So if we're looking at the patient who is having the intracerebral bleed, and we take a look at the hemispheres of their brain, what's happening is they're going to be having progressive blood buildup within those hemispheres, right? So we draw a small little brain here. What's happening is we know we're having blood accumulating within that area of the brain that's affected. So with blood building up, again, we expect to see progressive symptoms like we do in our subarachnoid. So if we picture again, we'll say this is blood building up in the area. If we have our initial hemorrhage coming into this area here, what's going to happen is eventually the hemorrhage is going to continually expand because if clotting factors don't do their job and we don't impair circulation in that area, and again, the brain generally needs to have circulation in all of these areas, we get a progressively increasing area of hemorrhage. And that's going to cause, very severe signs and symptoms for these patients. So generally what we're going to see in these patients are symptoms similar to our subarachnoid bleed in the terms of they're going to describe a headache. And it's generally going to be described as kind of the worst headache they've ever had, radiating down to the neck. We can also see things like vomiting and seizure in these patients. So you can see headache, vomiting due to increased pressure onto the because of increased pressure onto the medulla, and then seizure as we're continuously breaking down neurons. Again, if we look at our neuron, what we have inside is usually an extensive amount of glutamate. So if this is our neuron, and I'm having ischemia and rupture in the area, and I'm having breakdown of these neurons, and I can expose their cell walls, what's going to happen is I'm going to release a large amount of glutamate into the surrounding area. Well, glutamate is primarily an excitatory neurotransmitter, so if I'm releasing glutamate all throughout these areas here, what's going to happen is it's going to overexcite the brain and the patient's going to be at risk of seizure. So for our intracerebral bleed, we can see signs and symptoms that are very similar to stroke. Usually they're focal in nature, or they're usually, what that means is related to one of these areas. So we have a bleed within the cerebral lobe or the basal ganglia, the cerebellum. So we start to see focal neuronal deficits related to the bleed in that area. And as this condition progresses, the patient's usually going to end up going unconscious. These these types of bleeds generally progress very quickly, and the patients will become unconscious quickly. And associated with that, we may see things like vomiting, pupil disturbances, and seizure. Things that generally cause our intracerebral bleed are things like anticoagulant therapy, trauma, aneurysm, and hypertension. So people who have high blood pressure have increased risk of having these types of things happen to them. So again, what we can see here is it's generally a bleeding within those internal aspects of the brain that's going to cause the problems. And again, they generally have a more rapid progression as we have blood accumulating within the internal portion of the brain, or the parts of the brain that are allowing it to do its function. And along with that, we'll have some focal neural deficits. Patients are more likely to go unconscious quickly. They're likely to be complaining of headache prior to going unconscious, and vomiting. These patients are at high risk of vomiting due to increased pressure on the cerebellum and medulla. So that's what we're looking at in terms of an intracerebral hemorrhage. In our next video, what we're going to talk about is an increase in cerebral perfusion, decrease in cerebral perfusion pressure with hemorrhage, and how that's going to result in some of the common signs and symptoms we see between both of these types of stroke.